Well, 3 days ago, we announced that we will be extending the stabilisation phase to 21st November. I know many are disappointed, but we do need to protect our healthcare workers who have been working very hard for close to 2 years now to take care of our loved ones. Let us give them some relief by taking a bit more time in our journey towards COVID resilience so that our healthcare capacity will continue to be available for those who need it. I would like to reassure everyone that we remain committed to living with COVID-19. We will continue to monitor the situation over the next few weeks to see if the situation improves or remains stable and assess whether there is scope to further ease some of the safe management measures. In the meantime, we will use this extension to build a stronger foundation that will enable us to safely resume economic and social activities in time to come. First, we will adjust our healthcare protocol, particularly for the home recovery program. Today, the home recovery program is already the default option for those aged 5 to 49 years old and vaccinated individuals aged 50 to 79. The HRP has made good progress. More of us are now familiar and comfortable with it. Our processes and support system for the HRP are also more established and stabilized. Therefore, we will now extend the HRP to pregnant COVID-19 cases who are fully vaccinated, below 35 years old and less than 26-week pregnant. This will allow more to recover at home. Second, we will further expand our vaccination program so that more of our population is protected from severe illness. We will be including Sinovac in our national vaccination program. HSA and the expert committee will be issuing a statement on this shortly. For those who are yet to be vaccinated, you can now choose to be vaccinated with Sinovac under the national vaccination program. We have also made good progress on our booster shots. To date, more than 650,000 individuals have received their booster shots. For those who are eligible, please come forward to receive your booster shot so that you can continue to enjoy a high level of protection against severe disease. Minister Ong and DMS will share more details on the vaccination program later. For individuals who are medically ineligible for the national vaccination program, we will give special concession for them to enter premises or participate in activities where the vaccination differentiated safe management systems are required, such as shopping malls, attractions, hawker centers, and coffee shops, starting from 1st November 2021. For those who are medically ineligible for mRNA vaccines but are eligible for Sinovac, they will need to be vaccinated with Sinovac to be considered to be fully vaccinated. But we will give them a grace period up till 31st December 2021 to receive their Sinovac vaccine. Third, we will adjust measures at our workplaces and allow some activities for seniors to resume with measures in place to keep everyone safe. Although work from home will remain the default, we recognize that some workers will need to return to the workplace from time to time. By now, about 96% of our workforce has been fully vaccinated. However, there remains around 113,000 unvaccinated employees, and over 10% of them are seniors. To continue to keep our workforce safe, starting from 1st January 2022, only workers who are fully vaccinated, have recovered from COVID-19, or are medically ineligible for vaccination under the National Vaccination Program can return to workplace. Unvaccinated workers will need to be tested negative for COVID-19 if they need to return to the workplace. We would like to seek the assistance of employers in encouraging their unvaccinated employees to get vaccinated as soon as possible. We will also resume selected wellness activities for seniors. We understand many seniors have been responsible and staying home for their own safety. However, keeping active also helps our seniors to stay physically and mentally well. Therefore, we will carefully resume selected organized wellness and social activities for seniors who are fully vaccinated. These may include physical exercises like qigong, outings, and learning journeys. More details will be announced at a later stage. I hope for your understanding, patience, and support as we strengthen the foundation that will help us to live with COVID-19. Let us all do our part by keeping to the SMMs and exercising social responsibility so as to relieve the strain on our healthcare system and our healthcare workers. I would also like to encourage everyone to make testing a way of life. I'm confident that if we work together and press on in this journey ahead, we will be able to get through this wave. Thank you. I now ask DMS to give a quick update from the medical situation.
Thank you very much, Minister. Yesterday, the Ministry of Health reported 3,637 cases of COVID-19 infection in Singapore, with 3,039 cases in our community. I'll paint you a snapshot of our local COVID-19 situation so as to depict the context behind the changes that we are announcing today. About 3.5% of all unvaccinated local cases had a more severe illness requiring either oxygen supplementation, ICU care, and this contrasts with 0.6% of all vaccinated cases. Just over 17% of those who are infected with COVID-19 infection were people above the age of 60 years. Proportionately, more people who are older are hospitalized with severe infections, need oxygen supplementation, or need ICU care. And when I look further into the data of those who are infected above the age of 60 years, there is a proportion of those who are not fully vaccinated trending upwards, whilst those who are fully vaccinated, that proportion has correspondingly decreased over time. It's been said that COVID-19 is now an epidemic of the unvaccinated getting infected, getting severely ill, or even dying. This has been observed in other countries, and regrettably, it now appears to be the case also in Singapore. And if you remain unconvinced of this, I will highlight additional statistics, some of which have been shared previously by Minister Ong and myself at previous media conferences, but we have refreshed some of that data. The overall risk of infected COVID-19 patients who need oxygen supplementation, ICU care, or who have died is 8.1% of all unvaccinated people, and this compares to 1.4% for fully vaccinated people. This means there's a relative risk of 5.8 times more for an unvaccinated person to get a severe infection compared to vaccinated people. And if I only focus on those who were ever in ICU or those who had passed away, the relative risk for the unvaccinated persons is 10.4%. For those who have died from COVID-19 infection, the unvaccinated and infected persons had a relative risk of dying of 11.7%, higher than that in vaccinated people. If we now consider that the older people also have a higher risk as a result of their age and chronic medical conditions of getting severe infections, needing ICU care, or even dying, those above the age of 80 years and were unvaccinated, that risk was 21.7% compared to 3% in the vaccinated group. The unvaccinated seniors above 80 years had then a 7.2 times relative risk, higher than that of their vaccinated peers, of needing ICU care or death. For the bigger group of seniors, again above the age of 80 years, who needed now not just ICU care, not just having a risk of dying, but say having oxygen supplementation needs, the risk in the unvaccinated group was 52.7% compared to 13% in the vaccinated group. And this is a relative risk of 4 times higher in the unvaccinated group. For those of you who believe that you are younger and so do not need to get vaccinated because your chance of getting severely ill or needing ICU care is low, you should note that those infected with COVID-19 and even between the ages of 60 and 69 years carries a higher risk of needing oxygen supplementation, ICU care, or dying. That risk is 27.8% if you're unvaccinated versus 2.1% if you're vaccinated. And that means you are 13 times more likely to have these requirements, needing higher care, needing ICU care, or even dying if you are not vaccinated. And if I only look at those who required ICU care or who passed away, you have a risk of 8.2% of getting into this situation if you're unvaccinated and only 0.3% if you're fully vaccinated. And in other words, you have a 27 times greater relative risk of needing ICU care or dying if you're aged between 60 and 69 years and unvaccinated compared to vaccinated people in the same age group. There are some who look at the figures and say that, well, the absolute numbers of those who have been vaccinated appear to be greater than the numbers who are unvaccinated and are in hospital. That is true, and this is because the total numbers of people who are vaccinated in Singapore is far greater than the remaining people who are unvaccinated. And therefore, even if that risk of getting infected, needing hospitalization among those who are vaccinated is low, in absolute numbers, that number may still be higher than the number of those who are unvaccinated and infected in hospital. But if you look at some figures, for example, if you look at the proportion of those who are unvaccinated and vaccinated in the ICU over the entire population, then you end up with numbers very similar to what I described earlier. 3 per 100,000 unvaccinated versus negligible numbers. When you round it off, it's almost 0 per 100,000 vaccinated being in that similar situation. So please don't be complacent and assume that your younger age sufficiently protects you from not needing vaccination. It doesn't, particularly if you have chronic medical conditions like diabetes, hypertension, heart disease, chronic lung conditions, cancer, or if you're immunocompromised, or if you're even obese. Tragically, we have seen people delaying vaccinations because they were complacent and thought they would not fall sick, only to find themselves not only infected, but also in the ICU. Others have thought that their beloved seniors were protected by staying at home and not needing vaccinations. The facts show otherwise. So if you're still remaining unvaccinated, I strongly urge you to step forward and get vaccinated now. We have made it easier for you to do so, and now also provide you with a greater choice of options with the PISA approval from HSA and the endorsement from our expert committee for COVID-19 vaccinations for the Sinovac vaccine. Today, about 68% of infected people are in our home recovery program, with another 4% in our community treatment facilities and 6% in the acute hospitals. And the remaining reside in community facilities because they are unable to safely isolate at home. Home recovery remains a safe default option for the majority of COVID-19 patients, and we will continue to monitor them who are recovering at home and support them with telemedicine services. And should they develop more severe symptoms or have life-threatening emergencies, the 995 emergency ambulance service will convey them to the hospitals for further care. We have expanded our telemedicine services and call center capabilities so as to better support the increasing number of well but infected COVID-19 cases who are on home recovery. And this means that it is easier now to access care while recovering at home. Many GPs have also indicated their willingness to continue supporting their patients with whom they have long-standing relationships. They remain another source for medical help for those on the home recovery program. Community-based pediatricians have also volunteered their time to support children who are recovering at home. And I wish to thank my primary care and community specialist colleagues for stepping forward to provide support and care. They join their colleagues in the hospitals and form part of our national effort to provide better care for COVID-19 cases. Yesterday, we had 1,609 patients with COVID-19 infection admitted into our acute hospitals. And of those hospitalized, the numbers of cases needing oxygen supplementation has stabilized over the past 5 days, with 338 cases needing oxygen support and 57 cases in the ICU, needing that critical care to support their breathing and oxygen needs. There are many other patients in the ICU who are either COVID-19 cases who require additional treatment from the ICU healthcare teams beyond just treatment to support lung function, and also patients with non-COVID-19 life-threatening medical conditions who require that ICU care. And our overall ICU capacity remains sufficient for our present needs, and our overall ICU occupancy hovers between 72% and 78% in our public hospitals. We are mindful that the numbers of COVID-19 cases may increase quickly over a short space of time, and we have now taken additional steps to further increase our ICU capacity as a contingency. Our doctors and nurses in the hospital, and particularly in the ICUs, continue to work long hours and do their utmost to provide the best of care for their patients. We are working with the hospitals to mobilize additional support for them. We presently have more than 1,900 beds in our community treatment facilities with an occupancy of just under 50%. We appreciate our private hospitals and primary care groups who have stepped up to support the running of these facilities in partnership with our public hospitals. And we will continue to add further capacity to our CTFs in anticipation of more patients requiring care there over the next few months. Our expansion will see another 600 beds added before the end of October and a further 2,000 beds before the end of November. Coming back to vaccinations, as of the 21st of October, 84% of our population had completed their full vaccination regime and 85% had received at least one dose. I strongly urge all who have not vaccinated yet to step forward to do so. This is not only to reduce your risk of getting infected, but particularly of getting a severe infection or dying from COVID-19. So the announcements we make today regarding the PISA approval being granted to the Sinovac CoronaVac vaccine and the provisions we have made to make vaccinations more accessible will help to improve our overall vaccination coverage and facilitate our strategy to further protect our community against COVID-19. Thank you.
Thank you. Kenneth went to great length explaining the benefits of vaccination because, as many of you know, there has been, I think, a message going around saying that, wow, ICU beds 40% occupied by vaccinated individuals. So MOH come clean. MOH have always been releasing as much data as we can. Data that we think will help the public understand the situation, understand the benefits of vaccination, including all the data that Kenneth just cited. But I think such selective quoting of data, 40% ICU occupied by vaccination, by vaccinated individuals, therefore vaccines don't work, I think this is selective use of data to mislead people, and it's a disservice to people. If we just, it's not about transparency of data, it's about the right application of math. As I said before, if the whole 100% of our population is vaccinated, every single ICU case, every single death case is vaccinated. It doesn't mean vaccines don't work. What you need to look at is the incidence rate. What is the base, And a very stark piece of data is this. We have 1.5% of seniors, or rather, we have a group of seniors that are still unvaccinated. They account for 1.5% or slightly less of the total population, and over the last 28 days, account for 2/3 of ICU occupancy and deaths. And that's how stark it is. So do get yourself vaccinated and be careful of misleading WhatsApp messages and poor math. We have several important announcements today, but rather than focus on them, let me give an overview of where we are in our transition to living with COVID. And in that process, I'll try to answer a few frequently raised questions. First question is, where are we heading and when will all this be over? Many people have that in your mind. We are heading towards a stage where we strike a balance and an equilibrium with the virus and able to live normally with COVID-19. So you think about this as riding a bicycle downslope. If you do nothing, the bike goes faster and faster until you lose control and the bike will crash. But if we apply the brakes just right, the bike can go down the slope at a steady, controlled speed. So the equivalence of the downslope is the Delta variant and its transmissibility. Left on its own, it has a reproduction rate of 6 to 8. This means for every infected person, he or she can pass to another 6 to 8 persons. It also means that every week, cases do not just double. Cases can increase by 6 to 8 times if you do nothing. That's when it's uncontrollable and the system will crash. That is why we apply brakes on the transmission. And there are 3 brakes. 1, border restrictions so that we don't import large number of infected travelers from overseas. 2, administer vaccines and boosters to our population. And 3, domestically apply safe management measures, which currently include measures like group of 2 and wearing of masks. In particular, vaccines and boosters are very key. They build up antibodies in our society, and as we open up activities, people may get infected and then recover safely. And in that process, it adds further immunity to our population. So as the resistance against the virus increases progressively, at some point, infection number will not go up anymore. It plateaus, and then it starts to come down. And that is why we say no transmission wave will last forever, because it is against nature. Then we may relax social restrictions, allow events, gatherings in bigger groups, and yet find that cases do not go up very sharply. It may stay at an acceptable level, probably a few hundred a day, and mainly mild infections. But some may still fall very sick, some may still succumb. No different from living with influenza today. And that is when we can live quite normally with COVID-19. Some safe management measures may still be needed, such as in Europe now, they are still needed. This includes reducing crowding within an enclosed space and wearing of masks indoors. How long will this process take? That's another question. As PM said in his broadcast 2 weeks ago, the process may take 3 to 6 months, and we all hope it will be sooner rather than later. But during this process of transition, we will not stay static, but we relax restrictions and stand down safe management measures whenever we can do so safely. And this is an important part of our transition process. Now let me talk about the 3 brakes: border controls, vaccines and boosters, safe management measures. And I will address common questions around them. On the first brake, border controls. The most common questions I've come across is, why are we reopening borders, yet not allowing larger groups for dining? This is because the brake of border control is no longer very relevant. When Singapore has very few cases, or when we had very few cases, and other countries had very high infection rates, we needed border controls to prevent infections from gushing into our borders, through our borders. Now the situation has changed. After going through big transmission waves for many months, the pandemic situations in many countries have stabilized, and their infection rates some of them are even lower than Singapore. So we can open up travel lanes with these countries safely. And further, to make it doubly safe and triply safe, we allow only travelers who are fully vaccinated. And second, require testing, whether pre-departure or on arrival. And this is why imported infection numbers, if you notice, is very low every day. And it's a very small fraction of total community infections. And further, there are many benefits to Singaporeans when we open up our borders. One, Singaporeans can travel for study, for work, or leisure with their family. Second, we can start to bring in much needed workers to complete our BTO projects to complete various public infrastructure and other projects that we need. Third, MOM can start allowing in more domestic workers to relieve the stress on many families in Singapore. Hence, we are making a few changes. We are lifting the not to land rule for Bangladesh, India, Pakistan, Sri Lanka, Myanmar, and Nepal. The situation in these countries have stabilized for some time, and there is no longer a need for a strict not to land rule. Further, MOM will also be increasing the entry of foreign domestic helpers. Today is 200 a week. It will be increased to 1,000 a week. And this will help them to start to clear the backlog of applications from families for domestic helpers. And MOM will review the entry number regularly together with the MTF with a view to try to fulfill the needs of families as quickly and as promptly as possible. And I think these two steps will make life easier for many businesses, for contractors, as well as for families. We have also made some adjustments to the risk categorization of several countries, and this is part of our routine fortnightly review. Details will be in the MTF press release. Let me now talk about the second break, which is vaccination and boosters. Over or around 20,000 individuals are taking their boosters every day, and close to 660,000 individuals have taken their booster shots so far. And we also continue to have a couple more thousand people every day coming forward to take their first dose. Yeah. In terms of eligible population, 94% have either taken or have booked their vaccinations. However, amongst the 6% eligible population who remain unvaccinated are 70,000 seniors above 70 years old or above 60 years old. They are at a high risk of falling very sick if infected with COVID-19. Some of these unvaccinated individuals are unable to take the mRNA vaccines due to medical reasons. Others may just simply prefer a non-mRNA vaccine. So we will make Sinovac vaccine more accessible to them, to encourage them to get vaccinated. The Health Sciences Authority has given interim approval to the Sinovac vaccine under the Pandemic Special Access Route, or PSA, similar to the Pfizer-BioNTech and the Moderna vaccines. PSA approval does not automatically mean that the vaccine will come under the National Vaccination Program, or the NVP. But given that there is yet to be a non-mRNA vaccine in the NVP today, MOH has decided to bring the Sinovac vaccine under the NVP. It will be, or the Sinovac CoronaVac vaccine will be for a specific usage, namely for individuals who cannot or do not want to take the mRNA vaccines. The Sinovac vaccine will be administered as a 3-dose vaccine. First dose, after that, second dose will be 28 days later, and third dose will be 90 days later. This 3-dose vaccination regime is in line with the WHO's recent recommendations after taking into account of international data and evidence of the efficacy of 2 doses. For those who have already taken 2 doses, they will still be considered as vaccinated, but will be scheduled to take a 3rd dose 90 days after the 2nd dose. This is because with a 3-dose vaccine and the interval between the 2nd and 3rd dose is quite long, 90 days, I think we are making a special provision to allow these individuals to be considered as vaccinated for a limited period, after their 2nd dose. Details will be in the press release. MOH recognizes that these changes will increase the demand for the Sinovac vaccine doses, and we are in the process of securing more supplies. For the specific usage I just described, the Sinovac vaccine will be administered for free and will come under VIFAP, the Vaccine Injury Financial Assistance Program. However, for some individuals who have taken the Sinovac vaccine before PISA approval was given and have paid for it, we will not be able to reimburse the cost, and we seek your understanding. MOH will also assign the vaccination center at Raffles City to administer the Sinovac vaccine, and this is on top of the 11 private clinics which has been assisting MOH in administering the Sinovac vaccine, and they will now come on the national vaccination program as well. I should clarify two other points. First, we will not be using Sinovac vaccine as boosters for those who have already taken 2 doses of mRNA vaccines. For these individuals, the expert committee recommends, and MOH agrees, that they should receive either of the mRNA vaccines as boosters. Second point, we will also not use Sinovac vaccine for children below 18. Sinovac's application for PISA and the interim approval granted is based on the vaccine being used for individuals 18 years and above. The manufacturer did not provide safety nor efficacy data of the Sinovac vaccine for children below 18. Notwithstanding, for children between 12 to 17 years of age who may be allergic or develop a side effect to the mRNA vaccine, MOH will be starting a separate dedicated public health program based on their own consent, to enroll them for the Sinovac vaccine, and details will be made to these individuals separately. Let me now talk about the third brick, which is our domestic safe management measures. And this attracts the most number of questions. As people feel that the rules do not seem to be consistent across settings. So why a big group is allowed here, but a small group allowed there? Why music is allowed here, but music not allowed there? So on and so forth. And during this pandemic, we understand everyone miss doing something we love, whether it is meeting friends, going to parties, playing sports, or dining out. And we will wonder why it cannot be resumed, especially when we see something else resuming. So why is it that the thing I love to do cannot resume? And businesses too, they want to do business properly and not having to receive financial assistance. We share all these desires, and we will eventually get there. But during the transition, the inconsistencies and then the confusion across settings is a very difficult problem to solve. We know the extreme solutions are easy to understand. Either on one end, a freedom day where all restrictions are removed, or a lockdown where everything is disallowed. Those are very easy to understand, very consistent, but both are not the outcomes nor the solutions we want. So long as we decide we take a middle path between the extremes, we will have to allow some activities but put restrictions on others. And inevitably, this will give rise to comparisons and then perceptions of inconsistencies. But if we are prepared to live with some inconsistencies, then we have a basis to move forward. Some can move forward first, others wait for their turn next. But eventually, everyone will get there. But if we want absolute consistency, it's either Freedom Day or lockdown. And then we may end up not moving forward at all. And if we can be able to take that approach, live with some inconsistencies, then we can tackle the real challenge, which is how can we progressively reopen while keeping severe disease incidence rate and death rates as low as possible. And the key there is to protect the vulnerable, because the large majority, 98.7% today, of people infected today have mild or no symptoms. So to protect the vulnerable, the most important aspect is to ensure hospitals not overwhelmed. Then our healthcare workers can do their best to cure people and to save lives. Another important aspect is vaccination in differentiated schemes, which is very important. And this will help limit the exposure of unvaccinated individuals, especially seniors, to settings where they could be infected. And if we can do this successfully, protect the vulnerable, then we can progressively open up to those at very low risk, such as vaccinated young people. And we can add testing as a further layer of protection. So these are some of the concepts we need to start thinking about. And Minister Lawrence Wong will be sharing some of these possible ideas. In conclusion, our approach is unique in the world. Most countries take either of the following two approaches, either eradication or living with COVID. We did both. We implemented an eradication strategy last year and a large part of this year when we were not protected by vaccines. A few months ago, after we had vaccinated the large majority of our population, we moved to a living with COVID approach, but do it progressively, step by step, not with a big bang. We see many countries now living life quite normally, with quite a bit of envy. They took a living with COVID approach from the start, went through big waves of transmissions, suffered many deaths. And we need to remember that today, when they live normally with COVID, they paid a big price. For countries such as the US, UK, Italy, Spain, France, the death rates there are about 2,000 deaths per million population. 2,000. For places like Germany, Switzerland, Netherlands, it's about 1,000 deaths per million population. Malaysia, which situation is fast stabilizing, is about 800, over 800. Denmark, about 460. Qatar, UAE, over 200. How about Singapore? We are currently at about 50 deaths per million population. Still rising, but thus far lower, much lower than the rest. So we have so far given our people very strong protection compared to many other countries in the world. But still, we mourn the loss of every life with their families and their loved ones, and we cannot let up the fight. So this is a difficult period as we ride through a big transmission wave, but we are making progress, and we will need to pull through together, taking care and balancing the concerns and the needs of families, of young people, students, healthcare workers, and businesses from different industries. And we thank everyone for your understanding and your support so far.
Good afternoon. We've explained earlier why the extension of the stabilization measures are necessary, but we've also said that these measures are not static and will be adjusted over time based on our assessment of the situation. Now, some have asked, what are we looking at before we can consider easing of the measures? Broadly speaking, we look at three areas. Number one, the rate of increase in infection numbers every day, because that rate of increase will impact on demand for healthcare services. Second, the proportion of infection cases that fall seriously ill, because these are the ones who need to be hospitalized and will likely need oxygen supplementation or ICU care. And thirdly, as a consequence of the second, we look at occupancy rates in our hospitals, especially in our ICU facilities. In fact, we intend to update our daily reports soon with some of these indicators so that the public will be able to see the same indicators that we are monitoring closely. Now, zooming in on these three broad areas, one key indicator that we are watching closely is the weekly infection rate. That's the ratio of cases in the past week over the week before. In some ways, it's a very crude measure of what the epidemiologists call the reproduction rate, or R. Right? But we are using a crude measure of it by measuring the ratio of cases in the past week over the week before. This ratio used to be 1.5, which suggested that cases were doubling every week or so. It's now come down to just above 1. And that means that cases are still increasing, but at a slower rate. But because cases are still increasing, it's still resulting in pressures on our healthcare system. We monitor this ratio closely, and if the ratio comes below 1, and our hospital and ICU situation remains stable, we will make some calibrated easing in 3 areas. One, we are looking at allowing team sports to resume. For example, a group of 5 people can play football with another group of 5 people or any other contact sports. Second, we will look at resuming more activities in our schools and institutions of higher learning. And thirdly, we will allow family members from the same household to dine together in F&B establishments up to a group of 5 persons. These are calibrated moves where we assess the risk to be acceptable. For example, with activities in schools, IHLs, many of these activities are masked up, so we think the risks are acceptable. Where sports are concerned, they do not have their mask on, and there are people interacting closely together, especially with contact sports, but we can mitigate the risk by requiring the participants to do ART tests, antigen rapid tests, before participating in the activity. And for dining, again, it's high risk, but because the people coming to dine together are from the same household, the risk can be mitigated, but then it's an issue of enforcement. How do we go around ensuring that across all F&B outlets, this rule is complied with strictly, and it's only people from the same household? So that's something that we are looking at. But potentially, these are the 3 next batch of easing moves we are looking at, subject to the conditions I just highlighted. Some people ask, why not do more? Why not just go further and relax further? For example, allowing group sizes to increase across the board to 5 or even 8 persons. And as you heard from Minister Ong just now, I think taking such a path of just relaxing measures across the board will cause cases to rise sharply. There is no doubt this will cause a resurgence of cases. And I think we have to ask ourselves, if this were to happen, what will we do when our ICU facilities get fully occupied? Already we are at 2/3 occupancy for ICU beds, 2/3. What happens if there is a surge of cases and we do not have enough ICU beds to take care of people who truly need ICU care? And we are not just referring to COVID patients, because there are still people, non-COVID patients, who do need ICU care. And already, we are postponing some of these elective cases, but we cannot hold them off indefinitely. So, this is one reason why, one critical reason why we do not want to relax across the board. We want to protect our healthcare system and our healthcare workers. Of course, the next question that people ask is, well, if you have to do things selectively and open selectively, why are you opening up in some areas but not in other areas? And Minister Ong has explained just now, we are trying very hard to take a middle ground approach, not to go into either extreme of staying put where we are, nor opening up too liberally and risking a surge of cases that can overwhelm our healthcare system. And taking this middle ground approach means that we have to be selective, and we have to open up in settings which we assess are more acceptable in terms of risk. How we do that, we try our best to assess these risks with experts, with our advisors. It will not be perfect, but by and large, where we assess the risk to be not as high, to be within acceptable limits, then we will want to move first, as we have been doing for travel. And as I highlighted just now, the next bound of easing will include the areas which I've explained in sports, in schools and IHLs, and in family dining, where we think the risks are also acceptable. So that's the journey that we are taking. And we hope people will understand the considerations that we are making as we make these calibrated moves. We know that there is a lot of frustration about the ongoing restrictions, but we also hope everyone in Singapore understands why the MTF has to take the healthcare considerations very seriously as we go about managing the pace of reopening. At some point, as we have said before, the wave will peak, and day by day, week by week, we are getting better and stronger protection through natural immunity and through the booster shots. And this will then allow us to continue with our path of easing without seeing another surge of cases. So we can have confidence that this path towards reopening and living with COVID will be followed through in the coming weeks and months. Thank you.
Thank you, Ministers and DMS. We will now begin with the Q&A segment. Dear members of the media, please remember to use the raise hand function if you would like to ask a question. Gentle reminder to speak slowly and into your mic when asking your question, and to keep to one question. May we have the first question from ST, please? Ray?
Hi, Ministers. Thank you for taking my question. Recently, we heard that there were two countries, at least Germany and the US, who have put Singapore on their list of high-risk countries due to the COVID numbers. And I'm just wondering if this is going to impact our further negotiations on VTL, especially with the coming reopenings with Australia and Malaysia and other countries. Thank you.
Those travel advisory is for their own citizens, alerting them that Singapore infection rates are higher, so take precautions when they are there. And if I'm not wrong, specifically, they will always advise that please get vaccinated before you go there. It does not quite affect Singaporeans or people living in Singapore traveling there under VTL, so long as we are vaccinated. Yeah. So we are, I think they are reflecting the fact that we are going through a big wave, and therefore infection rates is higher. But there's a lot of goodwill between these partners, not just Germany and US, but also Australia, that Prime Minister Scott Morrison just made an announcement yesterday, and Prime Minister Lee responded in his Facebook. So now I think everybody knows, everybody gone through these waves. We all know that it is a rite of passage we have to go through. At some point it will stabilize, it will come down, and we all want to work together, maintain our connections, our people-to-people exchanges. And so it should not, and I don't think it will, stop us from continuing our joint initiative to develop vaccinated travel lanes. Australia in particular, we have been in talks with them for some time. Even when I was Transport Minister, we've been talking about recognizing each other's vaccination certificates. I kept in touch with Minister Greg Hunt, as did Minister Gan Kim Yong, kept in touch with his counterpart, Minister Dan Tee Han. And so we have been able to bring forward and make progress in our discussion. And we are very happy that we are now each other's priority when it comes to border opening. Details are still being worked out, but we certainly look forward to the day when travel lanes are open again between Singapore and Australia.
Thank you, Minister. Can we have the next question from Zhao Bao, Ke Yang? Sir Ke Yang,
hello. Yeah.
Repeat the question. Thank you.
Good afternoon, Ministers and DMS. I have a question regarding the two effective virus vaccines, Sinovac and Sinopharm. Since these vaccines have been provided to people a few months ago, and we do have some clinical data over the past few months, is there any significant difference between people who completed the 2 doses of Sinovac vaccine as well as the 2 mRNA vaccines who eventually got severe illness and perhaps death? And I noticed that the announcement today is regarding Sinovac. How about Sinopharm? Is it being considered to be part of the national vaccination program? Thank you.
I'll take that. There's been no application from Sinopharm, but we had an application with Sinovac, and as you know, it has been given interim approval. The number of doses being administered in Singapore is not big enough for us to do a comprehensive study. Not for Sinovac, and for Sinopharm is even lower. But there has been quite good data coming out from Brazil and Chile, but that was pre-Delta. In EC19's recommendations that they are releasing today, I think some of those data will be released, and I think it will address your question. So there are some comparisons of vaccine effectiveness against infection, against getting severe illnesses, as well as death, and so we can make some of the comparison there. But I think what is important is Sinovac is now approved, it's under the NVP, and is another option for people who have not been vaccinated. It's a minority, but it's important for you to get vaccinated and protect yourself against the virus.
Thank you, Minister. Can we have the next question from Channel News Asia? Charlene, please.
Hi, Ministers and DMS. Thanks for taking my question. So earlier on, DMS did give some information about recent cases, but I have some about the recent deaths involving some younger people, as well as some who have been vaccinated, but actually don't have any underlying conditions as well. Wondering if we could find out any more information about these cases, for those that have been vaccinated. Was it due to did the vaccine not work for these people, or how did the treatment work out? Why were they still affected by COVID so greatly?
Thank you very much for your question. It's important to acknowledge that the vaccinations do give some level of protection, but it's not 100%. So there will be people who still get infected despite the fact that they are vaccinated. And the data I mentioned earlier and shared did share what that relative risk was. On the balance, it is still more risky to continue not to be vaccinated than to be vaccinated in terms of getting infected, getting a severe infection, getting into the ICU for care, or even dying. Those who had vaccinated, in fact, had protection to the extent where their risk of getting into the ICU, of dying, was comparable to someone who was unvaccinated at a much lower age. So a person who was age 80, who is vaccinated, now has a comparable risk of getting a bad outcome, similar to that of a person who was in his 50s and unvaccinated. So in that sense, it's clear that vaccination does protect. But because it is not 100%, there will be some who unfortunately do have a more severe cause and unfortunately may pass away. In the data that we've seen, these are almost invariably those who have chronic medical conditions, those who already may be frail, and who have a lesser reserve in their body, such that the insult associated with the COVID-19 infection causes them to be very, very sick. And I had shared just now what some of these conditions were that were associated with a worse outcome in both the unvaccinated and in the vaccinated group. This applies also for those who are much younger, who ended up in the ICU, and unfortunately, there have been a few young individuals who have passed on. They were also with these severe other medical conditions, independent of COVID-19 infection, that made them weaker, more vulnerable, and more susceptible to more severe infections and a bad outcome.
Thank you, DMS. We'll now take the last few questions. Can I have the next question from Tamil Murasu? Arshaf, please.
Good afternoon, Ministers and DMS. I'm Irshad from Tamil Murasu. just wanted to raise the question, with Deepavali just 12 days away, is there a possibility that the safe management measures be readjusted to allow for more people to visit households? Thank you.
We understand, there are communities, Deepavali is coming. It's not the first time that we are celebrating a festival in the midst of the pandemic. We have gone through a few rounds of this last year and this year. And as we have always explained, we will look at the infection situation and we will continue to review and update our measures. And as I just described just now, I've tried to share more what the MTF is specifically looking at that will enable us to do the next round of calibrated easing, the weekly infection rates, as well as our ICU situation. So if the ratio comes down below 1, if the ICU situation remains stable, I highlighted we are looking at 3 particular areas, which is for schools, for sports, and for family dining. I think beyond that, I know there will be further desire for other things, visitations, more easing, but I think we will have to consider these all separately and carefully, looking at the overall infection situation.